it is now. You may have heard that the eye is the window to the soul, but now we know it is the window to the whole body. By looking at the iris of the eye, we can tell about a lot of things about the whole body. We can tell about the genetics actually. Now, if I look at your eyes, I can tell which areas you should be concerned more. So we call them the nurture points. For some people it is the lungs, for some people it is the cardiovascular system, maybe the digestive tract. So by looking at the eye, we can tell which area you should pay more attention to and which area you should nurture more. And also I can tell the problems or health issues you might get from your mother's side and the health issues you might get from your father's side. So we are looking at like 3 generations, and so glad to say that the reports we give is like 95% accurate. So it is better than most of the tests available. Now if you check your blood, urine or any other test, you will get the report. If you get a disease or some abnormality in the report, that means you have already got the thing. But by iridology we can tell before you even get the disease, we can tell which diseases are more prone for you to acquire, like that. So if for children it's very important, because if they get to know which areas they should be concerned about, they can prevent these diseases. So we have known about this saying, prevention is better than cure, for years, for centuries, but this is the first time we can actually prevent something when we know that it's coming.
So is this in practice in Sri Lanka?
Yes, of course. I have my own clinic at Rajagiri Healthy Eyes, and I'm teaching Iridology as well for Sri Lankan students and as well as Indian students. So before this corona incident, like once in every 3 months, I travel to India to teach my Indian students. A lot of doctors, they learn this Iridology. Now, I have to say, this is very useful for Western doctors, then Ayurvedic doctors, acupuncturists, for any kind of health practitioner, because once you know the person's constitution, once you know whom you are treating, like Hippocrates said that it's always better to know what kind of person is having the disease more than what kind of disease the person has. So by iridology we can tell exactly what kind of person this is, how is the structure, how is the digestive tract, and which kind of food you should eat, which kind of job you should do actually.
Now I think I need to kind of look away from you. I wonder if you've already figured what I should be doing right now. And you did mention that you're the first Asian to get this award, and from
Yeah,
Iridology Instructor of the Year and also the Iridologist of the Year. So you mentioned that you're teaching this subject here in Sri Lanka. So how many are actually interested in it? Do you see a lot of people coming in?
okay, in India a lot of doctors, few are interested in learning new things, because I can't figure out the reason why, because maybe because most of the people are so busy while sticking into their practices and all. But in India, although it has a lot of competition, they are so much interested in learning these new things and to serve the patient best. Now your modality may be superb, like Western medicine, acupuncture, homeopathy, Ayurvedic medicine, everything has a very good thing. I mean, if it's very good for the patient, but if you really want to treat your patient or the client well, it's always better to know which kind of client you are having. So how is the digestive tract? Now I have seen a lot of naturopaths, they tell to eat raw vegetables, because if you eat raw vegetables it's very good. But for some people raw vegetables is not good because they don't digest raw vegetables well. So if you know iridology, if you can see that in the iris, you can exactly tell which kind of food and how to eat it, whether you should eat raw or steam or boil, likewise.
How long does this take for you to check?
Okay, it takes like 30 to 40 minutes. Sometimes it's around 1 hour. Just we have to discuss and we have to inform everything to the client as well. So basically it takes like 30 to 40 minutes and 1 hour. And if they need a full report, we can give a full report within like 3 to 4 weeks.
And you mentioned that this award usually is given to people in the Western countries, so which obviously means that this is in practice in those countries,
Yeah,
isn't it?
because IPA, that is the International Iridology Practitioners Association, was formed in USA. So most of the iridologists, the international iridologists, are from USA or Australia. So even my teachers are from USA and Australia. Madam Betty Sue O'Brien, she's from USA, and Madam Tony Miller and Sir Christos Miliankos, they are from Australia. Then Ellen Tart Jensen, she's from USA. So most of the iridologists are from USA, Australia, Germany, Europe, and those countries. So uh, I am the first Sri Lankan who was a member, and even in India there were no members of IPA. So I joined IPA in around like 2016. Then I got certified by the IPA, International Iridology Practitioner Association, and then I got certified as an instructor. So I'm the only instructor for South Asia. Then I started teaching iridology in Sri Lanka and India. So they studied all the achievements and all. Then actually I wasn't aware that I participated as a speaker at the global conference in Australia in 2019. I wasn't aware that I'm going to be awarded this Global Instructor of the Year award, because it has never been achieved by any Asian. So then suddenly when the time comes, they told my name, and they have selected me and awarded me.
Right, so that certainly is an achievement, being a Sri Lankan and an
Yes.
Asian, to have something which is kind of the first time for Asia.
Yeah.
And speaking of iridology, you mentioned that in the Western countries like Australia, this is in practice. So how can we make this a common thing here in the country?
Okay, first of all, I have to teach a lot of students, like a lot of doctors, about the subject, and they have to start practicing the subject. So uh, it will be common now. At the moment I have around like 14 students in Sri Lanka. So most of them will be qualified as certified as iridologists in the next year, 2000, in the end of 2020 or 2021. So then we have a plan of developing the subject, and we organized the Asian Congress of Iridology also in Sri Lanka. It was the first one was in 2017, the next one was in 2018. So in 2020 we were just about to have the Congress again in Sri Lanka, but because of this COVID uh, pandemic, it was postponed. So hopefully we will have the next Asian Congress also in Sri Lanka by 2021. And likewise we are raising awareness, and if anyone is interested they can follow us, and we have a Facebook page, Sri Lanka Iridology Association, and they can get to know more about iridology.
And can anyone practice this, or does that person have to be a doctor per se?
Okay, at least they have to have a very good knowledge of the anatomy and physiology. So I prefer taking students from the health sector, or at least they have to have studied biology for A levels.
Right, so those are the requirements.
Those are
and
the
even the
requirements.
practicing doctors can
Yeah, of course,
certainly
it is very useful for the doctors, because, like I said earlier, they can really know what are the conditions, the constitution of the person.
Right, and we're coming towards a close as well, so I want to go back in time. I mean, in terms of how you